is National Retinol Day. Dr. Jordan Carqueville joins us now to share everything you need to know. And boy, is there a lot when you dive into this world.
For sure.
Okay, so retinoids is the prescription. Retinol is stuff that you can get over the counter, right?
You got it.
Okay, what is it exactly?
So retinol, that term is synonymous with vitamin A.
Okay.
And vitamin A has breakdown products that include retinaldehyde, and then it breaks down further to retinoic acid, which is the active ingredient.
Okay, I remember as a prescription, it was called Retin A at one point,
Yes.
right? Yeah,
That is a brand. You remember, it still is.
Yeah, okay, well, these are the over-the-counter brands.
Yeah.
What is so different about the over-the-counter brands versus something maybe you can get from a spa or something you can get as a prescription?
Sure. So, yes, this section is the over-the-counter, and over-the-counter tends to be less potent.
Okay.
They usually are retinols, okay, so just the straight vitamin A. And that makes them not potent because they have to get broken down, a couple steps to become that active ingredient, retinoic acid. The retinols can be marketed as different strengths. Not all of them are like
marked.
These aren't marked, but these are. This is 0.3, and this one has a pro. It's 0.5%.
Okay.
So the higher percent, the higher the concentration of retinol.
Okay, so how long would you have to use something like this before you start seeing some improvement in your skin?
Probably 3 months.
Oh, okay.
Yeah.
That long.
Before you start seeing improvement.
To really see improvement in the collagen, to stimulate it, you'll probably start seeing dryness right away.
Right.
So irritation, dryness. So, and we can get into that when you ask me how to use this stuff.
Okay.
But yeah, you'll start seeing some side effects. But those true results of the collagen stimulation may take between 8 and 12 weeks.
Okay, so that's why you probably want to go to the medical grade or just skip right to the prescription.
That's right. So medical grade skincare can be bought, as you said, med spas, in doctor's offices, and some skincare websites. So those are going to be more concentrated products. So these ones over here are actually retinaldehyde. So it skips that retinol. They're formulated from retinol to just be retinaldehyde, which then only has one more step to go to that active ingredient.
Okay.
So these are very elegant. They're a little bit more expensive, but they're more potent and quicker to get your endpoint.
Okay.
This is a brand that's just, this one is just retinol, but it's really high quality, it's formulated well, less irritation, more tolerability.
So like in a month, could you potentially see results with that then?
Yeah, I think you'll start seeing that decrease of the stratum corneum, the top layer of skin, and brightening.
Okay, but if you go to a dermatologist and say, I want an actual retinol, what will they prescribe you?
They'll prescribe a retinoid.
Retinoid,
So
okay.
retinoid, there's one that's over the counter, and that is adapalene.
Okay.
It's branded as Differin, or this one I brought, Effaclar by La Roche-Posay. But most retinoids are prescription.
Okay.
That is the active ingredient alone.
Okay.
And so there's lots of different formulations, again, that make them more tolerable because these are going to be more effective and more harsh.
Okay, wait, but this was over the counter.
Yes, so that one's the lowest potency synthetic retinoid, so adapalene.
Okay.
So it's great for kids, for acne. It's good for anti-aging. It's a little bit more tolerable, but more effective. So this is going to be your most effective type of over-the-counter product.
Okay, but who can use that? Like, I have rosacea, I am sensitive, and the couple times I tried any retinols, my face has been peeling off.
Not everyone is supposed to use a retinoid. Okay. So they are trying to formulate products that rosacea patients can tolerate, but people who have eczema, very sensitive skin rosacea, they just probably shouldn't use them.
Just get old?
Yeah. No. There's a place for laser and all kinds of other peptides and other skincare. But retinoids, by nature, it's an acid.
Okay.
So acids, they break down the barrier. They can cause irritation, redness, burning, dryness. They make you more susceptible to allergies. So if you are sensitive, some people just can't break through.
Okay.
I do want to add that most people, when starting a retinol or retinoid, will experience a little bit of dryness and irritation.
Which is why moisturizer and sunscreen is so important.
Yes. So I just kind of brought a couple things over here.
Yeah.
You want to wear sunscreen because it's taking retinols and retinoids, they thin your top layer of skin, making it more susceptible to sunburns.
Yes.
So that protective layer that's why our skin looks brighter, because you're getting rid of the dull, dead skin cells.
Okay.
So you want to protect that little bit of skin that's, that's there.
Right.
And so that's your sunscreens. And then moisturizers always have
Okay, just to get in the weeds a little bit, encapsulated retinol. What is that and what does that do?
So retinoids have been around for a long time, and they're constantly looking of ways to improve them because the effects are really great. Encapsulating these products, these high potency retinoids, will help bioavailability, absorption into the skin,
Okay.
and tolerability. Tolerability is the biggest problem. A lot of people just want to quit it. So these ways that they're coming up with now, it's helping.
Ingredient we talked about, it's like BACH, it's a plant-based.
Bakuchiol.
Bakuchiol.
Yes, so that is in one of these. So bakuchiol is a plant-based, similar to a retinoid. It kind of triggers some of those same receptors to stimulate collagen. So it's more tolerable.
Okay.
Bakuchiol.
Bakuchiol, okay.
Okay. I
So
say
much.
it's so much here.
It's so much.
Talk to a dermatologist.
Yes.
Get your best advice from an actual doctor, right?
Right?
I'd say.
That's what you say, right? Because there may be something else that might work better for you,
Right.
like a laser.
Like a
or
laser.
something else, right?
Yes, very effective.
Very effective.
All right,
Dr. Carqueville, thank you.
dermmic.com is where you can get more with Dr. Carqueville. Thank you so much for
Thanks,
joining us. We
Erin.
Thank you.
appreciate
It's
it.
good talking to you.
Yeah.